Tonight at 11, health officials in the U.S. are sounding the alarm on the monkeypox outbreak. They call it a public health emergency. Just doing that frees up federal funding and resources to fight the virus, which has now infected more than 6,600 Americans. But some in Cleveland's LGBTQ community are blasting state and federal response to monkeypox. News 5's Catherine Ross explains how some organizations say they are stepping up to fill the gaps.
Lately, this Gordon Square Community Center has been fielding a growing community concern.
We've pulled, this sort of list and information from the Centers for Disease Control website.
Board member Kenyon Farrow says the LGBT Center of Greater Cleveland has been inundated with questions about monkeypox.
But they're just getting phone calls left and right and fielding phone calls because people are desperate to try to get vaccinated.
Thursday, the Department of Health and Human Services declared monkeypox a public health emergency. The virus is known to cause flu-like symptoms and painful rashes or lesions. It spreads through close contact with infectious sores or bodily fluids. The CDC says the virus is spreading predominantly among men who have sex with other men.
I am hearing from people all the time here in the state that they are terrified of monkeypox because they've seen the pictures, they've seen people post, on social media who've contracted it.
As of Wednesday evening, the Ohio Department of Health had reported 34 monkeypox cases. 10 of those are in Cleveland. Farrow calls the state's response so far disappointing and says he had hoped it would do better after going through the motions with the COVID-19 pandemic.
Unfortunately, because of the abandonment, frankly, of the Ohio Department of Health and the Governor Mike DeWine, it has been left up to individuals and organizations to try to muster a response and respond to community.
At the end of July, the ODH director declared monkeypox a disease of significant public concern. The department says it's received just over 4,200 doses of the 2-dose vaccine, but Farrow says finding the vaccine has been difficult, and he believes state leaders are overlooking an already marginalized group.
Specifically here in Ohio, I think part of the issue, frankly, is the state politics. This is currently a virus that is primarily impacting gay and bisexual men.
For its part, the LGBT Center has been directing people to medical resources, and it plans to host vaccination clinics at its building in the coming weeks. Farrow hopes the declared public health emergency pushes the state and federal government to bring their responses up to speed.
Begin to really just get the information and turn, the public's attention to it so that we can help stop the spread of this virus, which, is preventable.
In Cleveland, Catherine Ross, News 5.
We reached out to Governor DeWine's office to see how the state plans to help. We have yet to hear back. The Ohio Department of Health says it's working with local health departments to provide more testing, contact tracing, and antiviral medication. It also expects more than 13,000 additional doses to be sent to the state over the next 6 weeks. With school now getting underway soon, there's some concern the illness could spread into classrooms. The CDC says monkeypox is spread through close personal contact, including contact with rashes, scabs, or fluids from someone infected. It's also spread by touching objects or fabrics that someone with the virus has used.
There is a risk that this is carried in what's called fomites, which are inanimate objects. Toilet seats, if you want to say that, but basically bedding, sheets, things like that.
The CDC says scientists are still studying if the virus can be spread when someone has no symptoms. Health experts say school districts should develop a plan on how to handle monkeypox and keep cleanliness a top priority.